Dear viewers, in last video I discussed about sick day rules in general. I discussed what is this concept, how sick day is defined, and why is it important to know about sick day rules. In today's video, I will discuss sick day rules in specific context to diabetes mellitus, both type 1 and type 2. What to do when you are sick and have type 1 diabetes. In my last video, I discussed how to define sick day. You can check details in last video, but in general, sick day is defined as any acute illness that may reduce fluid intake or increases fluid losses from the body. So, what is specific for the patient with type 1 diabetes who falls into this category? The key principle of managing such situations include: never stop insulin completely. Even if the patient is not eating, basal insulin must continue. Frequent glucose monitoring is required. Ketone monitoring is essential. Stopping insulin can rapidly lead to diabetic ketoacidosis, DKA, severe hyperglycemia, death. Recommendations: check blood glucose every 2 to 4 hours. Check blood ketones if glucose greater than 250 mg per deciliter. Maintain hydration. Consume carbohydrate-containing fluids if unable to eat. Seek medical attention if ketones rise. What are sick day rules in type 2 diabetes? Patients may require temporary adjustment of medications. Particular concern exists with: Number 1. Metformin. Temporarily stop metformin if vomiting, diarrhea, significant dehydration, and severe infection. Reason: increased risk of lactic acidosis and acute kidney injury. Number 2. SGLT2 inhibitors. Examples: empagliflozin, dapagliflozin, and canagliflozin. Temporarily stop during acute illness. Reason: risk of euglycemic DKA and increased dehydration. Number 3. Sulfonylureas. Examples: gliclazide, glimepiride. May need withholding. Not eating adequately. Reason: risk of hypoglycemia. When a patient of diabetes should seek immediate medical attention. Patients should seek urgent evaluation if they have persistent vomiting more than 4 to 6 hours, inability to keep fluids down, severe dehydration, altered mental status, blood ketones greater than 3 millimoles per liter, severe hyperglycemia, symptoms of DKA, reduced urine output, hypotension, and presence of severe weakness. Remember, sick day rules are preventive measures used during acute illness. Insulin should never be stopped in type 1 diabetes, even if they are not eating anything. SGLT2 inhibitors should be stopped during acute illness because of the risk of euglycemic DKA. Medications are generally restarted once the patient has been eating and drinking normally for 24 to 48 hours and is clinically recovered. Here I finish. Hope you like this information. See you in my next video on sick day rules for another disease entity where same principle is applicable. Till then, bye and take care.